Good morning, and thank you for finding the Memorial Foundation. My name is Samantha Searles. I'm a registered nurse at Children's Village Medical. I want to share some information regarding COVID vaccines and COVID-19 in our community. Today is February 5th, 2021. First off, to share some local COVID numbers, we have had more than 26,000 positive cases of COVID-19 in our county and 373 deaths. We're often reassured when we hear about decreased numbers in hospitalizations or a decreased number of patients on ventilators. This is truly great for access, but these decreased numbers sometimes represent people that did not get better and are part of that 373. Our county population is about 251,000. About 14% or 35,000 people in our county are over the age of 65 or phase 1B for vaccine distribution. As of February 1st, Yakima County had administered 19,865 vaccines. We have a long way to go, but we are on our way, and community members requesting vaccine access will help to get us there. There's a lot of myths about the COVID-19 vaccine, and I just wanted to bust a couple of those. One vaccine is better than the other. Not true. Both the Pfizer vaccine and the Moderna vaccine have very similar efficacy rates. Dr. Fauci actually received the Moderna vaccine. Another myth, the vaccine will only provide immunity for 3 months. The truth is, we don't know how long the vaccine will provide immunity. That was just a guess based on that we had people who had contracted COVID-19 a second time, and it was more than 3 months from the first infection. The vaccine will not provide immunity if COVID mutates. Again, a myth. Efficacy of the vaccine may be decreased as COVID mutates, or the vaccine may not prevent an infection, but it should decrease the severity of the infection. And our last one, people have gotten COVID-19 from the COVID vaccine. The story we were hearing about was actually someone who had COVID but did not yet have any symptoms. The vaccine was administered, and before it had time to start working or developing immunity, the virus progressed and the patient did pass away, but this was from COVID and not the COVID vaccine. We want to do some comparison information between Moderna and Pfizer. The Moderna vaccine is shipped frozen, but it's typical freezer temperatures, and it can be stored at 30 days refrigerated or longer if you do keep it frozen. The Moderna vaccine has to be thawed for administration. The Pfizer vaccine is shipped in special shipping containers and stored on dry ice or in an ultra cold freezer. The Pfizer vaccine has to be reconstituted for administration or liquid added to it. The dose for a Moderna vaccine is 0.5 milliliters, and the dose for a Pfizer vaccine is 0.3 milliliters. Both vaccines have 10 to 12 doses per vial. I share this because sometimes we see pictures of people administering vaccines on the internet, and we zoom in to see how much liquid is in that syringe. That's why they look different in different pictures. So when you get your first dose, people will say, well, when do I get my second dose? For Moderna, it's 28 days between your first and second dose, and for Pfizer, it's 17 to 21 days. For both vaccines, efficacy is about 60% 2 to 3 weeks after the first injection, and then your efficacy rate increases to 95% 2 to 3 weeks after the second injection. People are talking about side effects, and side effects after the second dose are more common. Side effects include headache, tiredness, muscle aches, headaches, pain or swelling at the injection site. These are really things that we're very familiar with hearing about as possible side effects from vaccines. Kind of a new one that we didn't hear about before is swollen lymph nodes from a vaccine. This typically happens in your armpits, behind your neck, or in your hip creases. And we do also have an observation time for COVID vaccines, which is different than vaccines have been in the past. After receiving a vaccine, you'll be asked to stay in the office for 15 to 30 minutes to observe for an acute or quick allergic reaction. And now finally, when is my turn for the COVID vaccine? We're currently in phase 1B of vaccine distribution and still vaccinating people that are in Group 1A. Group 1B is anyone over the age of 65 and all people 50 and over who live in multi-generational households. This is in addition to populations eligible during phase 1A, which includes healthcare workers, first responders, people who live or work in long-term care facilities, and all other workers in health settings. Our administrative staff, maintenance, dietary, and housekeeping, for example. How do I find reliable vaccine information? One place is the Washington State Department of Health website. It's available in both English and Spanish, and information includes current phases, vaccine locations, how to find your phase, information regarding vaccine safety, how the vaccine works, and vaccine distribution in Washington State. Thank you for joining me today and learning more about COVID and COVID vaccines.